I wanted, uncharacteristic for myself, just to pick up one or two points of light during my past year as chair of the Trust. Very briefly, one, the opening of what we're calling community hubs in, for example, Banbury, Oxford, Abingdon. These are ways in which our front line will literally be in the high street. Grant and I attended the opening of the community hub in Banbury, and people who have had experience in mental health services, staff, voluntary organisations, our staff will be there literally in a shopping mall in the middle of Banbury, and they will be open to questions, to people who want a referral, people who don't understand our services, and we hope this is going to be evaluated. This will be a way in which our interface with the public will become much easier for the public, much easier for people to actually walk in off the street and get advice, onward referral as necessary. It's one of the great pleasures of my existence as chair to take part regularly in what we call the recognition of our exceptional people. We have a scheme whereby monthly colleagues vote for their own colleagues who they think have gone above and beyond what might be expected of them. And each month we recognise their service with a gesture. It's a small plaque and some money which they can use either on team activities or for themselves. And I have to say, it's a regular source of real joy for me and colleagues to see how far some people will go. I'm not pretending that 6,000 staff are all saints, that would be wrong, but we do have some saints amongst us. We're opening shortly a new unit, a psychiatric intensive care unit for children and young people on the Warnford site. We're calling it the Meadow unit. You'll have the chance, those of you who haven't visited, to visit, and you will see what a modern mental health facility can look like in terms of rooms, in terms of how they're fitted out, in terms of the facilities, in terms of the gym, which actually came through charitable activity. And you'll see, if you go there, just what a decent therapeutic mental health inpatient service can look like. And then you might look at the services that we do offer elsewhere on the Warnford site, in our other buildings, to think there's a large, unfortunate gap between what should be 21st century mental health provision and what exists. We're trying to change that, but it's a struggle. Now, I'm very glad to hand over to Grant, who will say a few words about his past year and then introduce some of our presentations. Grant.
Thanks, David. I'd wait till I'm finished, but thanks. Good evening, everyone. My name is Grant Macdonald, and I'm the Chief Exec here at Oxford Health. And thank you, David. There's many people here tonight from different walks and backgrounds, but I want to focus in the staff of Oxford Health. I want to say thank you. Thank you on behalf of the board. The year we're talking about, Oxford Health, like the rest of the NHS, was starting to emerge from a global pandemic. We all know about that. But the last year was meant to really be the year we emerged from it. We became back to how we were in terms of the care we could provide. Our resilience should have grown, and we should have really started to continually improve again instead of holding things during that period. In the Trust, we were subject to a national cyber attack, which I think really has stopped staff being able to really emerge fully from COVID. It's the material impact on their day-to-day work and their ability to work with families and the people we serve, the patients or service users. And I say that because I think it's really, really important tonight that I acknowledge that. It's been really crucial. Those staff their attention's been diverted, the resource has been diverted, and I think their hope has been subdued a little. However, I think it's in that background that David presents the positives, touches on some of the great positives in the last year, and of course the annual report describes that. I want to pause on something that's not so positive, because there's enough people who talk about the positive, and I think days like tonight, nights like tonight, are a bit more than celebration. They're about facing up to difficult things. And more than anything else, we face one significant difficulty coming out of COVID, that international global crisis, to our local Oxford, Buckinghamshire, and our services throughout Bath, Swindon, Wiltshire. We faced that crisis around the IT outage, but I suppose the real crisis we face is access and timely access to our services. It's the thing that concerns us most at the moment, particularly for young people and families who are finding their way in life, but for all our patients, all our service users, making sure people are seen in a timely way by the right person in the right place is crucial, and now no more than ever. We can tell stories of referrals being double what they were before COVID, and we can hide behind some of those reasons, and they're true. We can talk about the national staff shortages and the impact that has on that, but we need to think about what do we do, because our duty is to see people promptly and give them the care they require, and effective care. So that's really something I want to just pause on and pull out tonight, because it matters an awful lot. I think one of the things that can seem less pertinent, I think, when you're struggling with that, is the development of knowledge and new ways of working. But now more than ever, our collaborations with Oxford Brookes and the University of Oxford are crucial to try and work out how can we do things in a more effective way? How can we do it with different types of input, different services and traditional staff? What research can we do? How can we understand problems so people can be seen promptly? And I think that sort of talks a bit to something that was crucial in the last year, which was the award to the BRC of sorry David, I've got a red card there, haven't I? The Biomedical Research Centre of £35 million for us to investigate what works for who. It's not an abstract thing, it needs to be a real thing. It needs to, yes, be about efficacy, but as much as anything, it needs to be about effectiveness, and it needs to work in the real world. And over the next year or two, that's something that we're going to focus on. The early intervention and psychosis services that we provide are built in global expertise and global cutting-edge research. But alongside that, they struggle to help people who are having the first onset of a psychotic illness in their lives with the day-to-day realities of how tough that can be in their families, in their work, and just getting on in life. So that, you can almost say, juxtaposition between global research and day-to-day life is what this service needs to work with. And I think it's a great example of evidence in the reality of caring for not all young people, actually, people with the first onset of psychosis. So I'll let Daniel and Anne introduce themselves. Thank you.
We are a specialist community mental health team made up of managers, doctors, psychologists, OTs, nurses, social workers, support workers, admin staff. And there's about 40 of us in the Oxfordshire Early Intervention Service, and we're based at the Slade site just in Oxford. We very happily moved there from being in the attic of the Wolford Hospital and really grew out of that space, so we're loving our new home, moved there last year. The NICE guidance for first episode psychosis is quite specific, and there are a range of interventions that we are required to deliver, and we are measured on quite a lot of scrutiny on the measurement. And the first thing I put in is the referral to treatment time target. You'll all know the 4-hour waiting time target in A&E, but we in early intervention had the first mental health treatment target, which was a 2-week referral to treatment target. So we have to respond to any referral for query psychosis, assess them, and allocate a care coordinator within 2 weeks. That's quite a job. And at the moment, we are a top performing team in that area. 84% we're managing at the moment. The at-risk mental state service is the holy grail for psychiatry, which is the idea that we might be able to spot early folk who might have some prodromal features, some pre-psychosis features that we can spot and intervene in order to prevent future transition to psychosis. Grant, we've had a lot of support from you and various other people here today to get this going, and we've recruited 2 people into this service thus far. We've just got going with that, and we're hoping it's going to be a standalone service, but EIS are currently giving birth to it. There's not been too many yelps or groans, but we are very much in that birthing process.
We always sort of talk about winter and planning for winter, and I think it's really important. This next presentation is about our community services in Oxfordshire. Our community services in Oxfordshire sometimes are overshadowed by the debate around mental health, sometimes, all the time, Emma. But I think it's really important to come to the surface, and we hear tonight about some of the good work that they do in partnership with colleagues in primary care.
My name's Emily, I'm the clinical lead. We've got Joe with us, who's one of our Band 7 specialist physios, and we've got Jane, who's our amazing administrator, and nothing would work without her.
Yes, quite right.
As we'll find out.
Lovely. So I'm just going to start off by explaining a little bit about us. So we're the Physical Disability Physiotherapy Service, otherwise known as PDPS for short, in our very creative photograph up there. As Emily's just said, we're a specialist, county-wide, community-based neurophysiotherapy service, and we provide long-term support and physio for people with neurological conditions, predominantly those conditions that progress over time. 50% of the referrals we get are for people with Parkinson's, which is the most common condition that we see, and that's followed by a cohort of people with MS, multiple sclerosis, and motor neuron disease, along with many other rare neurological conditions.
Like all NHS services, we aren't without our challenges, our greatest one being the capacity and demand. 1 in 6 people are living with a neurological condition, but sadly, unlike a lot of long-term conditions, neuro doesn't get the funding, the research and the acknowledgement that it needs. Despite our challenges and our long waiting lists, we are very humbled and feel very privileged to receive such wonderful feedback each month, and we have some for you.
I am in a privileged position to collect this feedback every month, and here you can read some of the lovely comments that we receive.
We are about to celebrate our 25th anniversary, so there will be party plannings I'm sure will involve exercise. We are currently completing a quality improvement project to improve the waiting experience for our patients and also to try and start their self-management journey earlier. We are hoping to collaborate with our neuro colleagues in the John Radcliffe and work on some Parkinson's related research with them. And finally, we will strive to be strong advocates for our patients and their families to make sure they live the best lives they can. Thank you very much.
Our final presentation tonight is in response to the Prime Minister's statement today around the sustainability agenda in the country. Seriously, we thought that it'd be really important to give you an update today on the work that we've been doing around sustainability in the organisation. We're acutely aware that we need to do more, as everyone does, and I think it's pretty clear today that we need to take a bit of our own lead in this, because I think the national lead will continue to slow down as the political reality bites, but we need to keep pushing forward in the organisation. So I'll introduce John, who's going to take us through this presentation. Thank you, John.
We've got 2 years as an organisation and a system to set out the approach to getting to net zero, and that will be around our travel, around our buildings, and around how we deliver care in a sustainable way. In terms of our overall footprint, we've reduced by 4%, which is not great, but it's good. But the good news is, since 2019, we've reduced our overall carbon footprint by 19%. So there is a good news story there. In terms of governance, we've got great governance. We've got an executive lead, Heather, and we've got fantastic support, and we always have had fantastic support from the board around delivering the net zero agenda. We've got a green plan, as we say, which has been signed off by the board last year. In terms of our energy is all procured via renewable sources. So we've got certificates in place now that 100% of our energy is sourced via offshore wind farms, which is really positive. So we're doing some work with Oxford University at the moment and the local authority, and this just gives you an indication as to where we are as Oxfordshire, but it is across the world. Things have changed in the last 10 years. You can see the blue is previously, and then the last 10 years how much temperatures have increased. Certainly we had the hottest June on record, so that just paints a thousand words. Great partnerships, Clean Air Hospital, we're developing that with the integrated care system, and it just looks at how we reduce our air pollution levels across the system. The climate's changing and it's just adapting here and now our buildings and how we work. So looking forward, new meadow unit, fantastic. We've got 47 solar panels on that, which is great. And again, that's 7 tonnes of CO2s which we're going to be avoiding. We're starting a feasibility study for solar panels. We've got electric car club, which is starting for the community team. Looking at reducing our energy demand at the moment around target temperatures, and that's going to happen over this winter.
So I'm Heather Smith. This is my second year with you presenting the accounts of Oxford Health. Ironically, I'm starting with a slide that's not from the accounts. So this is from the Oxford Health in Numbers document we've produced alongside the accounts this year. And part of the logic for this is that we should make more accessible and more understandable the information about the financial and other performance of a trust. So we should have a version of the truth at a high level that tells our story in pictures. And I think one point I may want to make about this graph shows how the income and expenditure of a trust has grown over the last 5 years. And I think as a picture, this comes across much more strongly than the text slides I've got coming up, or if I've given you a table. You can see how much our trust has grown. Now, a large part of that is about us taking on our provider collaborative roles, so the fact that we take money and then we pass it on to and manage the services of other providers where we've got a specialism, and that grows both our income and grows our expenditure. Another change that happened last year is we had a new audit team. So Maria, our new audit partner, came to Council of Governors and presented their findings. That is part of the AGM, but you consider what the auditors have told you as well, with their independent opinion. So because she's not able to come tonight, I'm going to show you the summary of her findings. I think the way Maria described it is this is a very clean bill of health. So this is a very clean bill of health. She needs to give an opinion which is unqualified. That means there's no qualification saying, well, your accounts are right except for this and except for that. So she has done that. She has to make other statements about what her perception of our value for money and other sort of statements that are set out here, all of which have come back clean.
A question we received earlier today. I noted the increase in management numbers and costs. 15% was one example given in a recent board paper, in addition to the setup of the local integrated care board for Buckinghamshire, Oxfordshire, Berkshire West, and would like to ask what impact these changes are having on direct patient services and recruitment and retention of staff.
I mean, just to amplify that, I mean, those of you who read the newspapers will be aware that there is a body of opinion in the country which feels that the NHS is overmanaged or has too many managers, and indeed there is a momentum I mentioned earlier behind a move to regulate managers, feeling that managers in the NHS, using a largely generic word, are too many. I think I'm going to pass this one, however, to our Chief Executive, who is, of course, our Chief Manager.
And a registered clinician. So, not a competent one, just registered. I think it's tricky, actually. Funny enough, and it might be the same people, our staff side have asked us the same question, and we've done some work that mirrors the slides that Heather presented. And between 2018 and this year, you know, we've increased our medical workforce by 30%. We've increased our nursing workforce by something similar, and that is hundreds of posts. So yes, there has been an increase in managers, but as there has in other roles, and there should be an increase because they're an extraordinarily valuable part of the care we provide. It's almost the implicit part of the question is, why have you increased managers? And as though somehow it's not a good thing to do, which I think is poppycock personally. I think the evidence base internationally is very clear that good healthcare systems have a good range of managers, and we know the NHS is undermanaged compared to other countries that our public often want to aspire to in terms of the healthcare system. So it has increased. We think it's increased proportionately, but we don't put posts in for the sake of it. There's a balance to be had, but we have a massive increased workforce, and I think it probably is in the region of 1,000 staff since 2018. Posts, not staff. We've got a lot more vacancies as well. Do we always get it right? No, we don't always get it right in terms of skill mix, but I think we are not overmanaged, and I think probably the information would show you that compared to other organisations. It's the competence of the people we have and how prepared they are to do their jobs, whether they're in clinical roles or managerial roles, that matter most, I think. Would be my short answer.
Any other points, questions? If not, I'm going to draw proceedings to a close. I think there's still maybe a cup of tea or a cup of coffee next door if you'd like to stay after that and have a chat. Just very briefly, we have necessarily, Grant made this point earlier, accentuated the positive. That's a temptation we always have. Well aware that there are points of darkness ahead of us. What I'm going to say isn't to say that we must do more politics. John rightly observed that whenever you consider questions of the environment, you're drawn into questions of value, which necessarily take you into conflicts and disputes in the national space. One phrase which our colleagues who do the neurological rehabilitation work, which they've so compellingly presented, used was the gap, the growing gap between our capacity and our resources. It could be, in mental health, in community services, in the next period of time, that you, the public, the members, the people concerned with this trust, might need to pay more attention to how that gap is to be resolved, either, unfortunately, by a reduction in capacity or an increase in resources, which necessarily might involve some political decision-making of a different kind. I'll leave it there. Thank you very much for your presence this evening, your contributions. It's been a lively occasion. Thank you for that. We strive to be, I hope this doesn't sound too pious, as open as possible. Do come. Our board meetings are in public. If they're online, join. If they're not online, they will be in a building which hopefully will be accessible to you. So please feel free to take part as participants and observers in our open sessions. But thank you very much for this evening. I've enjoyed it very much. I hope you have too. It's dark out there, so take care on your way home. Thank you very much.